Howdy. Welcome to another episode here of Ask Dr. John. I'm Dr. John, and I'm here in general to be asked questions and answer them. I will find topics like today, particularly from reading Catherine's newsletter, that get me excited and I'll want to talk about. However, I do want to answer your questions. And I'm going to give you really, really short answers to 3 questions right now. Really short, not doing them a service at all, but just to kind of let you know that I'm still listening. One was about zinc. And Catherine, do you remember what that question was precisely?
What form of zinc is best for immune system?
First, we have to conclude, prove, have conjecture, et cetera, that zinc is good for the immune system. Now, in most cases, I feel that it is. Zinc fuels many, many processes in the body, or is involved in many processes in the body, which if those break down, many of them will cause an immune dysfunction. With COVID and other viral illnesses, it was really, really a hot topic, because if zinc levels are high enough in the cells, then the virus has difficulty replicating. Now, that's not the only mechanism, but that's the one I generally talk about because it's the simplest and easiest to understand. And then we get to the question, which is the all-encompassing question for everybody all the time, is, should I take X? And the answer is, if you are deficient in X and you take X, you'll probably feel better. For example, in my case, I tend to be deficient in B12. When I get B12, I get really juiced up. I get a lot of energy. Other people who are not deficient in B12, it makes 0 difference to them because they're not deficient. Zinc would be kind of in the same category. Now, we actually will, in some patients where we have a suspicion of a zinc deficiency, we'll actually run a zinc test. We'll do a red blood cell zinc content, and we'll also do a copper content because zinc and copper, there's a particular ratio that they should be in for maximum health, and you don't want it to get skewed too far one way or the other. So particularly if I'm going to give someone copper long-term, and I do very, very, very minimal iron supplementation. Iron is actually quite dangerous in excess, and so I'm very careful about using iron supplementation. Now, I sometimes do it. I'm just very careful. I don't just throw iron at people, which has been a common treatment for practitioners historically. I'll want to do copper levels, which helps with iron movement and assimilation. If I'm doing copper, I'll also do zinc, or if I'm giving copper as a supplement, I'll generally do a zinc test and see if we also need to do zinc. Okay, so that's the beginning. Now, when you're dealing with zinc, as with most minerals, this is not 100%, but pretty close, you want a form that ends in the suffix ate, picolinate, citrate, malate. And this is true certainly with magnesium. You really want those forms. You don't generally want magnesium oxide. Very rarely, if you're really just doing a bowel cleanse, you might want magnesium oxide, but it doesn't absorb. The variety of minerals where the form ends in ate generally tend to be easier to absorb. They are bound to other chemicals that make them much more absorbable. Now, my favorite is zinc bisglycinate. I like zinc picolinate also, but not because they're particularly better for immune function, because I think most zinc is good for immune function. It's just a matter of being able to absorb it into your system and then get it into your cells where it's actually going to be protective for you. And so those are a couple of the forms that I really like. However, anything that ends in an ATE form is probably going to be okay. So that's number one. Next question was about sulfur, about using sulfur. What was it, Catherine?
After surgery.
After surgery. Sulfur is an incredibly important mineral in our body functioning and around healing in particular. And it really goes back to the same thing as I was saying with the zinc. If you're deficient, you won't heal as well. But if you have a huge excess, it won't do you any good. And so it's really looking at your sulfur levels. Now, in order to be safe, I generally would consider giving some amount of sulfur to help with healing. I wouldn't go overboard, but I would give some. I would use sulfur-containing foods, the sulforaphane foods, for example, green vegetables, broccoli, etc. Are very rich in sulfur. So yes, I like sulfur for patients post-injury, post-illness, or post-surgery. Another question that we got was a very good question on pelvic floor dysfunction in women. Men also get pelvic floor dysfunction, but the symptoms would be different. The issues are quite different, and it's much less common, particularly in women who have given birth. Then pelvic floor disorders are much higher. In women who have given birth twice, the rate of pelvic floor dysfunction is about 80%. Now, those are women that are actually going for treatment, talking to someone about it. So it may be higher, and a certain number of women just don't talk about it. So it's a big deal. And because it's a big deal, at some future date, depends on what happens in the world over the next week, whether I cover it next week, but at some fairly close in date, I'm going to talk about pelvic floor disorders. And the reason I'm not going to do it now is because there's so much to talk about. Pelvic floor disorders can be muscular. They can be structural. The bones aren't in the right place. Again, that's usually after giving birth. It can be neurological. It can be stress-induced. And the number of treatments is huge, a huge number of very effective treatments. One of the things that we've been doing a lot more of lately, and this isn't always classified under the category of pelvic floor disorders, but we're dealing with a lot of bladder issues, and particularly issues of bladder control and or urgency. And there we're doing techniques to stimulate the tibial nerves and the ankles. And this is something that there's a tremendous amount. I've seen 4 studies actually done treating those tibial points to treat urinary problems. And in the patients that we've seen for this problem, we have a 100% improvement rate. Now, sometimes it's 100% improvement, sometimes it's 40 or 50, but every woman that we've done this with has had some improvement. It's a very powerful, incredibly easy technique. And then after a certain number of treatments, I will teach these women how to do self-treatments to kind of stay in good shape afterwards. And so because it's so complex in terms of diagnostics, in terms of potential treatments, I want to actually give it enough time to really talk about it in detail. So Aaron, we will get to it soon. And I really want to thank you for the question. It's a very important question. So today, I'm going to talk about some issues brought up by the newsletter that Catherine sent out. So I'm going to share my screen. This is a really important title, actually, not just point. Has heart health in women been overlooked? And the answer is, oh my God, yes. Now, I get a lot of complaints from different quarters, about men's health getting more attention, sometimes about women's health getting more attention. And both can be accurate. For example, prostate cancer and breast cancer occur in lockstep. So as one goes up, the other goes up. And you can just track it over decades in terms of deaths from breast cancer, from prostate cancer, and they're the same. However, the amount of money spent on breast cancer, depending on the years, have seen between 8 times higher and 17 times higher than is done with prostate cancer. However, in the vast majority of cases, I have found that it's women's health that gets the short end here and is often overlooked. And I think the area where I see that the most is in heart health. I find that there is a plethora of very good research showing that women really have as much or more cardiovascular health issues as do men. And when I was in school getting my master's degree in traditional Chinese medicine and in my studies in medicine in general before that, That was not the impression I was given, not at all. And even today, if you look at many, many sources online and I look at old textbooks, it barely mentions women. And the reason for that, in my opinion, I could certainly be wrong. When I was growing up, I never heard of a woman dying from a heart attack. None of my parents' friends, none of my relatives. Now, women might have died from heart attacks, but it just wasn't really broadcast or maybe not even diagnosed. The big thing was young men dying of heart attacks. And by young, I mean under 50. And a couple of my dad's friends died at a relatively young age. One of them just pulled his car over on his way home from work and died from a heart attack. And he had just been at our house a few days before that. And so it was rather shocking. And so the thing is that men die from heart attacks at a much younger age on average than do women. And part of the reason for that is female hormones are magical. Men's are too, but female hormones I find incredibly magical. And when estrogen levels are high enough, it's very rare for a woman to have a heart attack. And most female heart attacks and other cardiovascular events really kick in after menopause. And if you look at the numbers of heart attacks for 40-year-old men, 40-year-old women, or 50-year-old men and 50-year-old women, you'll see a huge, huge increased number of men versus women having those heart attacks. But when you look over the age of 60, for example, you'll see that they match up, that women are having just as many heart attacks. They're having more of some kinds of strokes. So it's a huge problem. And here's the deal. I'll kind of go back to my diabetes training for a moment. So I was taught very early on in my diabetes training that diabetes was generally not diagnosed until people had been diabetic for 10 years. That's no longer the case. Diabetes tends to get diagnosed a little bit earlier. However, if you look at prediabetes and put that in there, and if you look at what the testing they're doing in some Scandinavian countries, showing the huge problems with prediabetes and suggesting that a great deal of that should already be called diabetes, you'll see that indeed, it's about 10 years from the time the blood sugar starts to rise, the hemoglobin A1c starts to rise. And the sweet spot, as you know, the brilliant new book that's out from Catherine, the sweet spot for hemoglobin A1c, which is the long-term measurement of blood sugars, 3 to 4 months, is 5.0 to 5.3. Well, prediabetes is not diagnosed until 5.7. So what happens between 5.3 and 5.7? You guessed it, damage. There is damage being produced when the hemoglobin A1c is between 5.3 and 5.7. Now, 5.7 isn't even diabetes. That's 6.4. And so you're seeing a huge range there where the cardiovascular damage is being done. The precursors to heart attacks, the precursors to strokes are already being formed. And this is in men and in women. So the problems that are going to lead to heart attack and stroke are already happening in much, much younger women and can be diagnosed very, very simply. We're looking at $20 to $40 worth of testing to determine this. It's not horribly expensive. However, those tests, A, are not being done often enough, and B, are not being evaluated accurately enough for women. So, as you know, the heart, the blood vessels, and the blood, they're making up this amazing and unique organ system in the human body. It's just mind-blowing how complex this system is. And I like this picture. See here, the red blood cells going through and the white blood cells, which are your protectors. And then you see the lining of this artery, which is several layers thick. There's a very thick muscular layer in here, this pink area, which contracts and actually is largely responsible for your blood flow. And then you've got this little white layer in the center here, the intima, which is the endothelium or the lining of the blood vessels. And that's where the damage starts. I'll talk to patients who come in with heart problems And I'll separate it out like, actually, you need a plumber for your heart problem, or with someone else, it's you need an electrician for your heart problem. So if it's clogged and blocked, it's like a plumber. And if it's an electrical arrhythmia, they really need an electrician. Sometimes you need both. All right. But anyway, this is going to supply all your nutrients, all of them. And that's not quite true. Some will go through your tissues, your skin, but almost all of your nutrients and oxygen and most of your waste gets removed. During the time that Chinese medicine was at its peak in terms of development and diagnostics, at that time in history, the Yellow Emperor had really started a huge building program where he worked to create canals connecting northern and southern China, and then all sorts of tributaries going off of those canals for trade and for warfare, to get his army around, et cetera. But basically, these were like superhighways. And because of that, much of the terminology in Chinese medicine came about during that time. And so a lot of it is described in terms of waterways, like you have the spring points, you have the well points, you have the river points, you have the sea points, and each of those point groupings is at a different level or a different distance from the center line of the body. Many of the translations call the energy pathways channels, just like a channel in a river system. And so these transportation systems are often described that way. So just so you don't get thrown off as we go a little further here. It provides everything. We put a few things here, but it controls really everything. And those actions are controlled by the autonomic nervous system. Now, the big thing now in alternative practice is the vagus nerve, the vagus nerve, the vagus nerve. The Chinese have been treating the vagus nerve for over 2,000 years. They were quite clear about the activities of the autonomic nervous system and the importance of creating balance. And so it's almost impossible for me to do an acupuncture treatment that is not helping the vagus nerve. And so the vagus nerve is really controlling all of these automatic functions in the body, controlling your heart rate, your digestion, your bowel function. Like, you don't have to think about that. You don't sit and go, all right, stomach, now digest. Now, stomach, move the food into my small intestine. Thank God you don't have to keep track of all that stuff. Or let's increase my respiratory rate. No, it all happens seemingly automatically, and that's the autonomic nervous system. With this, the heart responds to the stimuli and beats over 100,000 times each day, and you don't have to think about it at all. In fact, I tell people, if you can feel your heart, if your attention is going to your heart, there's a problem, because it should always be under the radar. We're going to talk a little bit about cardiometabolic disease, which refers to stroke, heart attack, type 2 diabetes, et cetera. These are things where the metabolism has been made dysfunctional and it's affecting these systems. You can figure 100,000 times. Imagine doing a biceps curl 100,000 times a day. Well, you can't do it, right? You couldn't begin to do that, no matter what the weight is, no matter how light the weight is, you couldn't do it. And yet the heart does that, and it's a muscle. It's contracting in that manner every day. And you hope it does not get tired and stop. It's an amazing amount of work put in. Now, if you're chronically stressed, and you all know this, whether you have been watching our webinars or not, we go into this a lot, but stress leads to every problem that you can think of. Depending on the study, between 85 and 95% of all doctors' visits, the root cause is stress. When we're looking at cardiometabolic disease, it makes up the 3 of the top 6 most commonly diagnosed chronic diseases. And I could argue that it's actually more than that. Because when you even look at things like cancers, there's a metabolic process that has gone awry. I would say more than 3, but we'll go with the top 3: diabetes, stroke, and heart attack. And managing those risks is by far the number one conversation patients have with their clinicians. You go see your doctor and they say, oh, we want to put you on statins. Oh, we want to put you on blood pressure medications. Oh, we want to put you on blood thinners, et cetera. Each of those is a cardiometabolic treatment. Traditionally, to prevent cardiometabolic disease, it's all been about managing lab values. Now, as you know, I have co-written a book on lab values, so I'm big on lab values. However, it's not the whole picture. And if you're relying on that as the whole picture, you're going to be left a little bit out in the cold. Unfortunately, with all these interventions, cardiometabolic disease is still a major, major killer. And in fact, more Americans are being diagnosed this year than were diagnosed historically. And it's affecting younger and younger people. And I could go into the reasons why I think that's the case, but that could take a week. All right. So I'm just going to say it is the case. We know lifestyle is important. We know physical activity is critical. The stress response, the environment, these are all really, really important. We really need to look at chronic inflammation and insulin resistance in this whole picture. So fortunately, my favorite traditional medical doctor wrote the classic, the Pi Wei Lun, which translates as the treatise of the spleen and stomach in about 1245, 1250 AD. And in it, Dr. Li Dongyan nailed it. I mean, he got it so precisely. And this isn't even something that was a thing, cardiometabolic disease, metabolic syndrome X, et cetera, until a few decades ago. And he nailed it in 1250. And he outlined in great detail the conditions, the diagnostics of the conditions, and gave extremely precise herbal prescriptions and lifestyle changes to treat those conditions. Unfortunately, most medical doctors haven't read that book. Probably 99.9% of them have not, and are still way behind the eight ball in terms of early diagnostics and early treatment of cardiovascular disease. Now, when it comes to heroic treatment, if someone has a heart attack, you've got a blocked artery. Those are really far along, and they're brilliant. They're brilliant. The life-saving methodologies are just brilliant, but they're not good at preventing early stage problems. They could be. I'm not saying they couldn't be, but they're just not. And a study that Catherine was looking at, they looked at the difference in microvascular health. So that's micro, really tiny, vascular blood vessels, health between men and women concerning the impact of coronary, meaning applicable to the heart, but coronary heart disease. It was titled Sex-Specific Association Between Microvascular Health and Coagulation Parameters. Microvascular health and coagulation parameters. Any of you that has seen me, 90% of you who have seen me have had me talk about sticky blood or blood stasis or the need to get blood moving better, because it is about 90% of the people that I see that need those treatments done. It's a total epidemic of sticky, thick blood that we're dealing with right now. This modern doctor, Lu Shun-yen, looked at the relationship between microvascular health and coagulation parameters. Coagulation meaning, how quickly, how easily, how effectively does the blood clot and unclot. You need it to clot, but it better break down when you need it to break down, the clots. As we've talked about in other of these, I'm going to call them webinars for podcasts, whatever you want. We've talked about the glycocalyx, the endothelial glycocalyx, the endothelium of the blood vessels, et cetera. We've done whole programs on that. And I have taught cardiovascular trainings for acupuncturists where I've spent a lot of time looking at the issues of the endothelial glycocalyx. Now, again, this wasn't even known until the 60s. And then it was only known by people doing research, electron microscopes, looking at the inner structure of the blood vessels. By inner, I mean inside, where the blood flows. And only in the last 10 years have I actually heard anyone, Western doctor, alternative doctor, naturopath, etc., actually talking about the endothelial glycocalyx. Now, over the next few months, you're going to hear it everywhere you go. Everybody's going to talk about the glycocalyx. Doesn't mean they can fix it. It just means that now they're aware that there's a thing. And it is the primary protective structure for the blood vessels. So you've got this big, thick arterial wall, very muscular, and then you have a one-cell thick lining, that's the endothelium. And then coming off of that endothelium is an organ, I'm going to call it, that really looks like seaweed being moved by the tides of your blood. And that's the glycocalyx. And that's the protective element. And you can barely see it here. This is kind of small. But here on the left, you're going to see a healthy artery. And you can see these little things come out here into the flow. And that's the glycocalyx. And that captures the bad stuff and helps the good stuff. And that can be measured, which is by something called glycocalyx-related perfused, by measuring the glycocalyx-related perfused boundary region, or the PBR. Problem is, the apparatus for that's $25,000. We've looked. We wanted to have one. We thought it'd be way cool. I'm not going to spend actually $25,000 for something that's honestly a really, really incredibly minimal benefit to our practice, because by looking at the tongue and by looking at the blood vessels on the surface of the ankles, and by looking at a variety of elements on the hands, and by taking the pulses, we get probably 95 to 98% of the information that we need to have about the health of the glycocalyx. I would love to have one because I think they're really cool, but I don't really need to have it in order to treat my patients. Now, it'd be nice for tracking purposes. We're looking at a variety of coagulation parameters or factors that make the blood sticky and can increase stroke, heart attack, blood clots, etc. And there are a variety of what are called factors. There's factor 5, factor 8, 9, 11, etc. And these are things that will affect blood clotting. There are thrombin generation parameters, again, good tests for that are very inexpensive, actually much less than $25,000. And then fibrinogen, which is the precursor for the fibrin deposits. And again, these are very inexpensive tests, the thrombin and the fibrinogen. Then we look at other factors of inflammation in the heart and the arteries, such as C-reactive protein, leptin, and then a variety of ways at looking at the glycoproteins. In this study, they revealed a very strong sex difference in the associations between glycocalyx damage and coagulation parameters. That was particularly true in women, and increased poor glycocalyx status was associated with higher factor 9 activity and plasma fibrinogen levels. The bottom line is bad. And it affects women even more than men. Again, they concluded in the study that coronary or heart health should be considered during early development of coronary heart disease in women. And I mean really early. I'm not talking about after a woman starts having symptoms. By the time you have symptoms, the condition is relatively advanced. I'm saying you need someone that's going to actually run the right tests and really interpret them in a manner that's protective. Again, since menstruating women have fewer heart attacks, often those are overlooked in women, those negative pathological development. And again, this Dr. Hans Zinc said that in previous decades, it was believed that men were more susceptible to coronary heart disease than women. But this study reveals that the risk of coronary heart disease in women is frequently underestimated, which we've been talking about. It confirms that systemic, non-obstructive, microvascular dysfunction. So systemic, meaning it's not just in one location, it's your whole body. Non-obstructive, that means it hasn't gotten to the place where you're actually having a stroke or a heart attack or a blood clot that's blocking the vessels, which causes problems in small blood vessels feeding muscular tissue. And this can result in coronary heart disease, and it's believed to be more common in women than in men. And it's not just a little bit, by the way. It's not just that, oh, they're about even. No, women actually are much more susceptible to this. some of the things that we all know that we should be doing more of, or continue doing what we are doing if it's enough. But it's really critical for women when we're looking at these cardiovascular issues. Continuous movement. What does that mean? Continuous movement. It's been found that small amounts of movement every 5 minutes, or small amounts of exercise every 5 minutes, and I'm talking like 15 seconds worth, is more effective than several minutes every hour, which is more effective than an hour once a day. So small movement, keep your blood moving. It's great. Go work with weights for an hour, for half an hour, and you'll get great benefit. However, you'll get even more benefit if you just run up and down your stairs during a commercial on TV. And they found that greater than 20 minutes of moderate to high intense exercise, at least 3 to 5 days per week, seem to be ideal on top of the continuous movement. Plant-based Mediterranean diet. I'm not a vegan, I'm not a vegetarian, but I don't eat much meat. So limit sugar, get lots and lots of diverse fruits and vegetables. Go outside your comfort zone. Go online and look at different vegetable dishes and things that you've never thought of before. Lean protein. I'm not so concerned with lean, but minimal protein, I'll say, by meat protein. And of course, manage portion size. And then stress management. This is the biggie. Commit to a plan. What's your plan? So if I ask someone, so how's your stress management? And they go, okay. And I go, what's your plan? If they can't tell me, they're full of crap. If you don't plan, you plan to fail, is the old saying. So you need a plan. What are you going to do? Practice deep breathing and meditation, get really good sleep. It's right at the top of the list. And take at least one 10-minute walk a day. Environmental factors, avoid harsh cleaners and detergents. There are lots of sites looking at how using some combination of vinegar, baking soda, not together, and some other common household safe chemicals, you can do a better job cleaning than with the really expensive, harsh chemicals. Practice good dental hygiene. Dental problems may be the number 2 source behind stress of illness. Choose organic food whenever possible. Yeah, it costs more. Don't eat as much. Eat 3/4 as much organic food. The price will be about the same, and you'll be way ahead in terms of doctor bills. I use a HEPA filter at home. We are polluted. Our air is polluted. So just kind of don't pretend it isn't. Omega-3 fatty acids. I prefer krill oil. Krill can be taken in much smaller doses to get the benefit than does fish oil. It is absorbed better. It's absorbed directly into some of the brain tissues. So it's my favorite, but fish oil is fine too. It's also a primary nutrient and protective factor for the eyes. It has several components that are very powerful for the eyes. Bergamot, good old bergamot, remember? Reduces cholesterol levels. We have supplements to lower cholesterol levels that are primarily different forms of bergamot. And it helps the entire cholesterol profile. Low density lipoprotein, high density lipoprotein, floating blood fats called triglycerides. It also reduces fat accumulation in the liver and helps clear fat from the body. Coenzyme Q10, one of my all-time favorites. I use this to control the pain from my arthritis. And if I take my coenzyme Q10 regularly, my pain is probably 10% of what it is if I don't remember to take my CoQ10. I do it at higher doses. Generally, you look at 50 to 100 milligrams is the recommendation for basic cardiovascular health. I do 1,000 to 1,500 to eliminate pain. And I've seen no studies that show that that's dangerous. But if you're just taking it as kind of a background supplement, I would say do about 100 milligrams. Fucoidan. I've done a couple of podcasts here on Fucoidan. I'm not sure if that's the proper pronunciation. I've heard it pronounced several different ways. And this is found in wild brown seaweed. Most of the seaweeds have really beneficial qualities, but the wild brown seaweed, which is rich in fucoidan, is really special. It helps preserve, protect, and regenerate that protective layer the glycocalyx. This is the number one thing that we use to preserve, protect, and regenerate the glycocalyx. And also, it will then, because it's doing that, lower blood pressure and cholesterol. So the bottom line, blood stasis is the biggest factor that I look for. Now, we're looking at hundreds of things, literally, it's not an exaggeration, most of which we don't even talk about. The shape of your ears, the colors of points on your ears, the way that your ear has different lines in it, et cetera, to a dozen different things on your hands. And then the pulses, which incredibly complex. But of everything, if there were only one thing that I could look at, it would be looking for blood stasis. If you got sticky blood, you're going to die younger, statistically, than if you don't have sticky blood. It's really that simple. So it is the number one thing overwhelmingly that I look for in my diagnostics. So diagnosing, preventing, and treating blood stasis before it becomes a chronic problem is critical. And the earlier you get to it, the earlier you treat it, the better off you are. So Catherine, any questions?
You have suggestions to lower A1c.
Hemoglobin A1c? Yeah, anything that one would do for diabetes or prediabetes. Hemoglobin A1c is just a measurement of glycosylated hemoglobin, which is sugar that's attached to a protein. And that sugar protein gets stuck to the red blood cells. As the red blood cells flow through your blood vessels, they literally bump into particles of this glycated hemoglobin. And some of it will stick to the red blood cells. And the thickness of that coating is where they get the measurement for hemoglobin A1c. So the less blood sugar you have in your cardiovascular system, the lower your hemoglobin A1c level is going to be. So everything that lowers hemoglobin A1c is going to include the things that we have listed here today. So exercise, I find that if hemoglobin A1c is fairly elevated, people on top of doing their regular movement and their walk really do well if they do a little high intensity weight training, about 40 minutes per week, which is not very much. Could be 10 minutes 4 times a week or 20 minutes twice a week, but they do high intensity weightlifting to the point where the muscles are exhausted. And that changes how the GLUT4 receptors bring sugar into the muscle cells versus leaving it in your bloodstream. So that's probably the fastest, most effective way to get it down. We will use a product called CM Core, which is largely a berberine compound, but has modified in a variety of ways. And we will use that to get the blood sugars down. And then, of course, anything that modifies your diet to get less simple sugar and less simple carbohydrate is going to lower your hemoglobin A1c level. I guess that's it. Next week, I'll have some new exciting things. I hope I'll have at least some new things. I want to thank you for tuning in, and I will be back next Thursday. In the meantime, be happy, be healthy. Thank you.